President Muhammadu Buhari observes private worship at home with family members. And after a successful completion of the 30 days Ramadan fast, Muslims in Nigeria have observed the Eid al-Fitr prayers amidst COVID-19 pandemic. Barka de Salah and welcome to Panorama. I am Habiba Oladipo. Muslim Ummah in Nigeria this Sunday joined their counterpart the world over in observing the Eid al-Fitr, marking the end of the month-long Ramadan fast. President Muhammadu Buhari, who worshipped at his official residence in Abuja, advised Nigerians to strictly adhere to the dictates of health professionals in order to stay safe as the country battles COVID-19 pandemic. And after a successful completion of the 30 days Ramadan fast, Muslims in Nigeria have observed the Eid al-Fitr prayers amid COVID-19 pandemic. During Dia went round to capture the general ambience in the Federal Capital Territory and reports that this historic development may not be forgotten in a hurry as the Ummah resorted to converting their living rooms and premises to Eid praying grounds.
This is the popular National Eid Praying Ground, which usually have mammoth crowd coming together to observe the 2 rakat prayers to commemorate the end of Ramadan fast. Unfortunately, the place is a shadow of itself due to the coronavirus pandemic. Even the environment attests to that fact. While roving the streets of Abuja to see how Muslim faithful are observing the Eid al-Fitr celebration, we are lucky to meet this family who just observe their Eid al-Fitr prayer. Salaam alaikum.
Wa alaikum salam.
We saw you observing Eid prayer here. Is this a praying ground?
It's not a praying ground, it's our compound. So we can't go out because of COVID-19 pandemic. So we decide we can't pray inside the room because this one is a special prayer. So we decide to just come out of our compound. You can see this is our house here. We didn't go far. And not this, we are one family.
This development is good because like last year, Salah, my husband was not around. He is at work and we did it alone. So at least today, the whole family did it together.
We perform Eid with our family. So we thank Almighty Allah. We are very grateful. We thank God.
I pray for Nigeria since when we start Ramadan. We dey pray for Nigeria, may everything just normal, just everything may go down. We dey pray for our president.
I pray for Nigeria. God bless Nigeria.
No doubt this year's Eid al-Fitr celebration will go down memory lane and be in the archives of world history owing to the coronavirus pandemic. However, the example of this family of Malan Ibrahim Ahmed Tijani shows that regardless of the situation, people can live in peace, harmony, and of course express love, just as exemplified by them on this celebration of Eid al-Fitr in Abuja, Doing, Dia, NTA News.
And the Nigerian Center for Disease Control has announced 265 new cases of COVID-19. A breakdown shows that Lagos State has 133, Oyo has 34, Edo 28, Ogun 23, FCT 22, Plateau 6 and Kaduna 5. Others are Borno and Niger with 3 cases each, while Kwara, Bauchi, Anambra and Enugu have 2 cases each. With the latest figures, Nigeria now has 7,526 cases of COVID-19 with 2,174 discharged patients and 221 deaths so far. We'll take some messages now. The news continues shortly. You're on to Panorama on the network service of the NTA. It's time for us to take a break here while Mohammed will continue from our Maiduguri Network Center.
Thank you, Habiba. Welcome to Panorama from Maiduguri Network Center. The federal government ministerial delegation on COVID-19 was in Borno State on assessment of areas requiring intervention for the containment and prevention of spread of the coronavirus pandemic in the state. The Ministerial Task Force on COVID-19, led by the Permanent Secretary, Federal Ministry of Industry, Trade and Investment, Dr. Sani Gwarzo, commended strategies by Borno State government to contain the viral infection. Paul Nkujevana reports.
The Ministerial Task Force on COVID-19, which comprised technical and infectious disease experts, was in Borno to interface and interact with the state team on COVID-19 to know their strengths and weaknesses and provide solutions where necessary. The federal team were taking around COVID-19 facilities to include testing and where the pandemic. Team leader of the Ministerial Task Force on COVID-19, Permanent Secretary, Federal Ministry of Industry, Trade and Investment, Dr. Sani Gwarzo, pledged federal government support to increase testing capacity with modalities to cope the spread of COVID-19.
They have a procurement plan, and their plan is proactive, that can last for 3 months. The procurement plan even has an alert system that shows you when there's an impending stock out, so that you can stock.
No mysterious death in Borno as assessed in Kano and other northern states.
Close to 40 workers in Borno State were treated for COVID-19, and most of them discharged from the University of Maiduguri Teaching Hospital Isolation Center in the last 1 month since the index case was confirmed. The chairman, Nigerian Medical Association Borno State, and leader, Health Workers COVID-19 Response Team, Professor Aliyu Mohammed Kodia, speaks about the state of health workers' safety and the need for continuous decontamination of health facilities. Awakar Mohammed Musa is our guide on this report.
Health workers are at the forefront of all measures to contain the coronavirus pandemic and are therefore subjected to many hazards in the line of duty. How can we imbibe the culture of continuous decontamination to make public places, medical institutions and facilities safe from COVID-19? Well, I have with me here the chairman, Nigerian Medical Association, Borno State, and leader, Borno Health Workforce COVID-19 Response Team, Professor Aliyu Mohammed Kodia, to shed more light on disinfection to curb spread of COVID-19. Sir, what is the present state of health workers involved in the COVID-19 health response, especially those who tested positive for COVID-19?
Thank you very much. The health workforce in Borno State, like all over the world, we are actually at the forefront and the front line in the war against the COVID-19 that is ravaging the world. During the course of the fight, actually some of us got infected and tested positive. We had quite a number, quite above, close to 40. And of course, we thank God that most of them are successfully managed in our isolation centers, and they have since been discharged, though we still have 3 in isolation but in good condition. We had actually we lost one of our beloved nurses. But so far so good. There has been a good progress, and they were managed in the isolation center in the University of Maiduguri Teaching Hospital.
All right. On a final note now, sir, how much value should be attached to decontamination as a safety measure to curb spread of COVID-19 in medical institutions and public places?
This is actually very essential. That is the most important part of actually preventive measures in curbing the transmission of COVID-19. Hygiene are actually all that is needed. From time to time, areas of constant use must be decontaminated or de-infected. And of course, it's good that we've seen both the teaching hospital and the authorities in the state have actually taken a positive measure in doing that. After the work of the day, the clinics and other utilities are disinfected actually every day. They use a spray, and the public health unit in the teaching hospital does that. In the state facilities, the state specialists, Marisho Ultra Modern Hospital, and nursing home, including the isolation centers in the states. The BOSEPA actually are responsible for that, and they do it daily. In fact, in some of the hospitals, they do not only disinfect the clinic and the ward areas, they also spray the whole of the hospital environment to see how that can be controlled.
That was Professor Ali Mohammed Kodia, the chairman, Nigerian Medical Association, Borno State, and leader, Borno Health Workforce COVID-19 Response Team. It's now back to you in the studio.
Thank you, Abubakar. Public disinfection through fumigation is a first-level decontamination measure stepped up to reduce human susceptibility to COVID-19 infection. This is in addition to other hygiene measures such as use of face masks, social distancing, continuous hand washing, and environmental sanitation. With ease and suspension of lockdown in many areas, how much has been done in the area of decontamination, and how can this vital component in the COVID-19 war be sustained as the economy gradually reopens and resumption of congregational prayers in worship centers? Imbibing the protocol of effective public and personal hygiene can reduce incidents of community spread of COVID-19 both at health institutions and public space. With me in the studio to discuss this issue is the General Manager, Borno State Environmental Protection Agency, BOSEPA, Alhaji Nasiru Ali Surendi. Sir, you're welcome to Panorama. Let's begin. How much effort has been made by BOSEPA in the disinfection of public places to prevent the spread of COVID-19?
Well, actually, when we get the signal in respect of the COVID-19 pandemic, and then we swing into action, we notify His Excellency the Executive Governor of the state before he constituted the state committee, which has been chaired by the Deputy Governor. We get the approval, and he has given us the marching order to make sure that we disinfect the community so that we can control the spread of the coronavirus. So we succeeded in disinfecting almost all the IDP camps within the state capital, and then the host community within the IDP camps. And then after that, then we see into action. Next, then we see into the action and respect highly populated areas such as market, and then we did the market, all the markets in the town, and then the parks. And then later on, we proceeded to addressing the host community, more where the IDP camps are staying within the community, not within the IDP camps. So after that, we disinfected almost all the banks that we're having in the state capital here, and then the governor gave us the directive to give them germicide chemical for them to be mopping their banks, and then all the surface areas. Immediately after that, yourself with your organization and all other agencies in the state which we disinfected the areas. So by doing so, it is we're performing our responsibility duty which has been shouldered on us. So we succeeded by doing so. So the University of Maiduguri Teaching Hospital, when they encountered the first index case of the COVID-19, so we were requested to go there and disinfect the University Teaching Hospital, which we did. I led the team by myself towards in the evening, and then we did all the necessary disinfection. But now on 20th, we get the approval from His Excellency. Now we are going to the local governments immediately after Salah, so that all the IDP camps within the local governments will be given the chemical, and then we are going to assign our officers to be there to disinfect almost all the IDP camps.
Okay. Talking about measures, what measures are in place to ensure compliance with strict hygiene measures for public safety with suspension or ease of lockdown?
Honestly, there's a lot of lapses in respect of the enforcement of the following the laws, because once if a law will be passed, it should be all at the national level. So our people, the culture of our people at times were very stubborn. We tried to disagree that this COVID-19 exists. But the most important thing, in order to control this type of things, all the law enforcement agencies should not use all the forces, but in sensitization and try to involve the communities, and then to make sure that these people will be to comply by avoiding in a conjunction places. So we have to adopt the culture of using face masks, and then washing our hands, and then keep distance and social distance within the community. But on appearing on all the wedding places or barrier places. So all these things we have to avoid it. So by doing so, honestly, we are going to control it. And
okay, and lastly, it is the duty of environmental health officers to support, minimize health and safety hazards. What is Bosepa doing to ensure they keep humanity from contracting COVID-19?
Well, our role, there is one thing that what we are doing now, we are trying as much as possible now in the next step to make sure that all the traditional rulers within the community are involved in this, and then all the youth leaders within the community also should also be involved in respect of this. So there was an experimental which we did during the lockdown. So people refused to comply, and people have been sneaking, going to different places. So honestly, by protecting ourselves, we are trying as much as possible to keep our family free from any danger. So our people should cooperate with the system and then follow the law which the government has imposed, so that people should not be a victim for the coronavirus.
Okay, thank you, the General Manager, Bosepa Nasru Ali Sorendi, for coming on Panorama.
Okay.
Let's pause for some messages. Thank you for staying tuned. Residents of Jere local government area of Borno State will now be receiving effective healthcare service delivery to their doorsteps, especially with the state battling the novel coronavirus pandemic. 2 mobile clinics and ambulance donated by federal lawmaker were unveiled to commence operation by the Borno State Deputy Governor and State Chairman COVID-19 Response Team, Umar Usman Kadafur. Yagun Subukar reports.
Jere local government, which is the second largest in Borno, located within the densely populated capital Maiduguri, has 12 wards, 6 of which are in the rural setting. Worried by the global health pandemic COVID-19 and its attendant consequences, member representing Jere Federal Constituency, Engineer Satomi Ahmed, saw the need to donate 2 mobile clinics and an ambulance to assist in meeting the immediate healthcare needs of the people. Already, 300 health personnel have been trained to sensitize the people on dangers of coronavirus pandemic and maintenance of safety rules.
In Nigeria, none of the members have done that. Idan ana da dan wani tsammanin wannan abu yana faruwa sai mai contact wani number da ya bayar, immediately motoci da doktoci za su dawo unguwanni su taimaka.
In addition to this, the lawmaker has provided 1,000 each of hand sanitizers and soap, as well as 100,000 face masks to be distributed to residents of Jere. The state deputy governor, who is also the state committee chairman on COVID-19, unveiled the mobile clinics and an ambulance to commence services for the people of Jere, pledging to support Engineer Satomi's effort with 2 million naira to assist in provision of logistics.
If we have such type of intervention from our representative, I think the government need to do only a small portion of it.
As they are providing a medical assistance, once they have seen any of the symptoms, they can advise, they can sensitize, so that the local people will understand this thing is real.
Health personnel who spoke to NTA News expressed their willingness to ensure all nooks and crannies of Jere are informed on existence of COVID-19 and safety tips to prevent spread. In Maiduguri, Yagum Subukar, NTA News.
The Shehu of Borno, Abubakar Ibn Umar Gaibe El-Kanemi, has charged people of Borno and beyond to strictly adhere to safety protocols to contain community spread of the coronavirus pandemic. The royal father was speaking to NTA News in an exclusive interview at his palace in Maiduguri. Kagama Mustafa Shehu now reports.
Coronavirus pandemic has continued to claim thousands of lives and more confirmed cases emerging globally despite effort to check its fate. The Sheikh of Borno, Abubakar Ibn Umar Garbai Al-Amin Al-Kalemi said, people of Borno demonstrated resilience over a decade of insurgency. As such, should do the same to stop the growing cases of COVID-19 in the state.
COVID-19 is real and it kills. Our people should know about it. The advice I'm going to give to our people is that they should strictly adhere to the advice given by the doctors with regard to this COVID-19. They should constantly wash their hands, use sanitizers, as well as maintain social distance and use face masks.
The royal father enjoined people to take necessary precautionary measures against the spread of the disease, such as avoiding crowded places except where necessary. The monarch reminded Nigerians that COVID-19 is real, as such harboring any sentiment or denying its existence would only make the condition worsen through community transmission. He charged the community and religious leaders join in prayers and always remember to adhere to hygienic advice for their safety and that of others. In Maiduguri, Paigama Mustafa Shiodu, NTA News.
This is all we can take on Panorama this afternoon. Wishing you all pleasant Salah festivities and do enjoy the public holidays. Good afternoon.